If your doctor has suggested IVF, here is what actually happens over the coming weeks, step by step. IVF means in vitro fertilization. Eggs are collected, joined with sperm in a lab dish, and the embryo is placed into the uterus. Doctors commonly consider IVF for blocked tubes, severe male factor infertility, endometriosis, unexplained infertility, or age-related decline. The cycle begins with hormone injections for about 10 to 14 days. These stimulate the ovaries to grow several egg-containing follicles. Frequent scans and blood tests track how the follicles grow. Doctors adjust the medication dose based on how the ovaries respond. Egg retrieval is a short procedure under sedation. A thin needle collects fluid from each follicle, taking about 20 to 30 minutes. In the lab, eggs meet sperm. Sometimes a single sperm is injected directly into each egg. This technique is called ICSI. Fertilized eggs grow into embryos over 3 to 5 days. By day 5, the healthiest ones reach the blastocyst stage. A thin catheter places a selected embryo into the uterus. The transfer takes just a few minutes, usually without sedation. Around 9 to 14 days later, a blood test measures pregnancy hormone. This waiting period is often the hardest part emotionally. Success depends most on age. Doctors also consider the cause of infertility, ovarian reserve, embryo quality, and overall health. IVF is generally safe. Known risks include ovarian hyperstimulation, mild retrieval discomfort, ectopic pregnancy, and higher risks if twins occur. Many people succeed after 2 or 3 cycles. Fertility teams also offer counseling to support the emotional side of treatment. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.